Today we are going to talk about dysthymia. We will explain what it is and how it differs from depression. In DSM-5, dysthymia is renamed Persistent Depressive Disorder. Dysthymia is a depressed mood, less severe than depression and that does not have the same symptoms as a major depression, or does so only in very short periods of time. Its evolution over time is usually more than 2 years or a year in children and adolescents. It is characterized by a prolonged low mood and sadness. The person suffering from it loses interest in things, and often sees himself as useless and uninteresting. The symptoms can be persistent or intermittent, of milder intensity compared to major depression, and are characterized by the fact that the individual is habitually sad, introverted, melancholic, excessively conscious, unable to be cheerful and worried about his personal insufficiency. Dysthymia usually begins in early adulthood, but the first symptoms can also appear in childhood or adolescence, and it lasts for years. Sometimes it is the consequence of an isolated depressive episode and can be associated with conflictive events, such as they can be, for example, a situation of mourning for the loss of a loved one, for the frustration of a project, or simply for a disappointment. Generally, after a certain period of time, most people overcome the bad trance and continue with their life with total normality. But when faced with the same situation, some people, on the other hand, react with a persistent sadness. These people react with a depressive illness that, in addition to the sad mood, will bring feelings of self-reproach and sometimes may even be accompanied by somatic symptoms such as headaches, digestive problems, and so on. The concept of dysthymia was introduced in 1980, to describe an affective symptomatology of a lesser degree than depression, and which occurs frequently in the population, but a large part of those who suffer from it are not treated, and although the degree of the symptoms it is moderate, does not imply that it is a mild disorder. Dysthymia is characterized by a chronically depressed mood, sadness, and discouragement, most of the day, for a minimum period of 2 years, in which 2 or more of the following symptoms appear: poor appetite or voracity, insomnia or hypersomnia, low energy or fatigue, low self-esteem, difficulty concentrating or making decisions, feelings of hopelessness. Because 70% or 80% of cases begin insidiously in childhood or adolescence, the patient feels that it has always been this way, that this is their way of being, something that the family environment confirms and then does not consult, and that is why it is not treated. A dysthymic person has never considered that it could be an underlying disease. They simply think that life is like that. Other descriptive characteristics and associated mental disorders are the following: feelings of incompetence, general loss of interest or pleasure, anhedonia, social isolation, feelings of guilt or sadness related to the past, feelings of irritability or excessive anger, decreased activity, efficiency, or productivity. Vegetative symptoms may appear less frequently, such as sleep disorder, appetite disorder, or psychomotor symptoms. It is slower. Those who suffer from dysthymia can spend days or even weeks feeling well, but it is usually an exception. They are almost always tired, depressed, meditative, complaining, sleep badly, and feel unable to undertake new activities. Despite everything, they can cope with the basic things of daily life, but does not find pleasure in what he does. Since it can be complicated by a major depressive episode, he is also at risk of suicide, especially because by not treating it, the patient incurs repeated failures that diminish his self-esteem gradually. Sex and age, women are 2 to 3 times more likely than men. On the other hand, in children the disorder occurs equally in both sexes, but in these ages, in addition to sadness, pessimism, and low self-esteem they present irritability, instability and poor development of social skills. This will bring with it a deterioration in school performance. Its first symptoms usually appear early, before the age of 21, but it can also manifest late, in adulthood. We must pay attention. When a person loses interest in the things they have been doing or feels tired, they do not want to participate in anything to share and enjoy life while changing weight and manifesting problems with insomnia or an unpleasant awakening, or by, for example, you have diffuse pain, negative thoughts, or you are frequently dull and slow and shows a deterioration in your work or academic life. Although it is not counted, you may have a dysthymic disorder. The important thing is not to resign yourself to leading a dark life. Avoid becoming chronic and make an early diagnosis. In the case of children or adolescents, the responsibility of the consultation will fall on the parents or teachers warned, on the form of presentation, and adults will be the family environment that suggests the early consultation. Prognosis: when there is a dysthymic disorder, there is a risk of complicating it with a major depressive disorder, which has a risk of suicide, in 10% of cases if it is not treated properly. Practical advice: try to share problems with your loved ones, with family, friends, or trusted people. Surround yourself with loving and positive people. Avoid social isolation. Increase physical activity. Avoid drugs and alcohol. Try to give yourself time to do activities that are enjoyable for you. Get enough sleep. Try to be critical of yourself. Surely you will have good things and bad things, like everyone else. Maybe you are good at painting, cooking, fixing appliances, or anything else. Enhance what you are good at. What you are bad at, try to correct them. But being critical, for example, if I make an effort I can be more pleasant with others. But if, for example, if you are very short, no matter how hard you try, you will not be able to play basketball in the NBA. That kind of things that are impossible to change, it is better to accept them. We must be realistic. We all have some kind of thing that we would like to change and we cannot. I repeat, we all have our limitations. Sometimes we tend to compare ourselves with others and we only see negative things in ourselves, and I repeat again, we all have good and bad things. If you have doubts about your state of health, consult your family doctor. If it is very difficult for you to make all these changes alone, consult a psychologist. It is not true that needing professional help is a sign of weakness. Normally dysthymia, like depression, requires help to overcome, at least from the people who love and support us. Especially do not isolate yourself, do not withdraw into your own world and ask for help when necessary. In summary, while major depression usually involves more severe and severe symptoms, dysthymia involves less severe symptoms. The symptoms may be the same, for example, apathy, insomnia, low self-esteem, hopelessness, only they vary in intensity. In addition, dysthymia at the clinical level manifests itself as a general and lasting state of discontent, certain sadness, pessimism, etc. This means that we can see people with dysthymia as more negative, and think that it is their way of being in general, since such alteration may have existed for years. On the other hand, In major depression the symptoms appear more intense and abrupt, and that often makes it possible to detect the trigger, or triggers, that have led to the depression. That is, it is not perceived so much as a general state of the person or a way of being, or that their personality is like that, as in dysthymia, but rather it is focused as a time or period where the person is suffering importantly. So far the video, I hope you liked it. If so, I would appreciate if you subscribe and give it a like. It will help us to continue with the channel. Thanks.